A lot of people, they get an MRI and they don't know what it says. So this is a little model of some vertebrae in the low back. And I'm going to go over the terms related to stenosis. Some people have heard they have spinal stenosis. So there's a couple of different ways you can get stenosis. One of them is a spinal cord stenosis. This is the spinal cord. It runs down your spine from your brain. And if the disc, the ligaments around the disc and around here get inflamed or bulged, that can press on the cord and it can decrease the space in that hole right there. And that would be a central stenosis. So there's other ways that you can get a spinal cord stenosis, and that would be that the bones are growing into the canal. So the ligaments are getting inflamed, the disc is bulging, or the bones are changing shape, reducing the space for that spinal cord right here. Now, another way you can get stenosis is called a foraminal stenosis, and that is where the nerves come out. So not the spinal cord on top, but the nerves right here. And if that hole right there, all right, that one right there, if that hole gets decreased in size for any reason, then we would call that a foraminal stenosis. So a central spinal cord stenosis or a foraminal stenosis. So it's a closing down. A stenosis is a closing down or a clamping down or reduction of the space where the nerves or the spinal cord should come out. So anyway, just some education there, because a lot of people come to us and they've been told that they have an MRI, but they don't know what it means. They've been told that they have to have surgery, and they're looking for an alternative. And sometimes we have to decipher for them and make sure they understand what they've been told at the orthopedic or the neurosurgeon and whatnot. And I think it would be important that doctors spend more time educating their patients on what is actually going on with them. However, we have these hallways in our office, and they're somewhat magical because people walk out the door and they walk down the hallway, and by the time they've walked down the hallway, they've forgotten everything that was just told to them. In many cases, we call them the amnesia hallways sometimes. So we try not to just sit in here and speak doctor talk to people. We want them to understand stuff, so we go over it, try to meet them at their level. But anyway, just wanted to give you some information on the health of your spine. I'm Dr. Dave Morris of Magnolia Medical Center here in Murfreesboro, Tennessee. We do root cause functional metabolic medicine and responsible pain management. Hope you found this information helpful. Take care today.